have the faith layer where a lot of people of faith don't even believe that they need therapy or should be seeking it. Then you have the stigma. A lot of people don't go because what does that mean? Does that mean I'm crazy? Do I want people thinking I'm crazy because I'm seeing a therapist? So you've got all these layers that contribute to why people are not getting the help that they need. And so it's a lot of education, but it's also opening up the door to resources. So we're going to have to depend on our nonprofits to be able to reach back and be able to help people who don't have the funds to get the help that they need. Mental health is your wealth. And so if we want to get real basic, everything that we do and all the choices that we have and that are that's required takes a certain level of mental capacity. And so the better your mental health, hopefully the better the choices you make. So regardless of people having babies with multiple men or whatever, everything starts with our mental. So we have to be able to make sure that we're doing all that we can to be mentally fit so that we are able to make better choices. And so it's even deeper than just women having multiple children with different baby daddies and all that other stuff. I mean, because you got people who are dealing with mental health issues on way more basic than just a baby daddy and how many there are.
Right. Yes, Dr. Chen, what you think about that?
As far as for, if people are wanting to get mental health help and they are experiencing economic challenges, thank goodness for the Affordable Care Act and Obamacare, because that was back in 2008 where they made the law where mental health treatment used to be separate from general health care. And so now it's all together. So even if a person has Medicaid or Medicare, or well, Medicare is not low income, but Medicaid is definitely low income, your therapy is covered. So that it is state by state, but your therapy is absolutely covered because they're not allowed to discriminate between traditional medical care and psychiatric care. And then if somebody is uninsured, one thing that I used to do when I was, didn't have, before that law was passed where your therapy was covered, I would do universities. That was the best way because you have student teachers. So a lot of the universities will have like $20 visits or very like sliding scale because they're training the student teachers that are going through practicum and things like that, or to getting their psychology or they are social work licenses and things of that sort. And then also there's community agencies that have sliding scale, and sliding scale just means it's based on your income and what you can afford to pay. And so I definitely utilize certain programs like that when I didn't have coverage or the economics to be able to do it. And, so you can also do psychology today. If you have insurance and you just want to find somebody, they have photos of the physicians. You can put things like what they you could ask, I want somebody that specializes in African-American or Black people or race sensitive. And they actually have that culturally sensitive care. Somebody's LGB, they have that where you can go in Psychology Today and some of those sites and put that in. So utilize those resources. I think, and people say, I don't want, Dr. Felice, I was kind of chuckling to myself. He said, I don't want nobody to think I'm crazy. But shit, folks walking around here acting crazy. Damn it, you crazy. Okay, get some help so you won't be crazy.
Can we just say this?